Hi folks, I've been asked to talk about bunions today, so I'm going to give you a quick overview about bunions. So a bunion actually comes from the Latin term for a turnip, because when it gets really inflamed and red, it looks like a turnip. What the bunion is not just a growth that grows over the side of the big toe, but rather also a separation of the first and second toes, okay, or knuckle bones, I should say. The toe actually tries to stay in its natural place, which is what creates a bunion, okay? So what we do when we are treating a bunion is, number one, alleviate the symptoms. Number two, narrow the foot. One of the ways that we can alleviate the symptoms without any surgery is get wider shoes, use a bunion splint, or use a bunion guard. But in terms of correcting the deformity, you can't do that without surgery. The surgery for a bunion really depends on how bad the bunion is, if there's arthritis in the joint, and depends on if you have any instability of the middle of the foot. One of the newer and cooler things in bunion surgery is the minimally invasive bunion. This is done through about 2 or 3 small poke holes around the foot, and then you create what's called an osteotomy, or we break the bone and we shift it over, and by doing so we actually correct this distance between the first and second knuckle bones. This is offered at a lot of places. We do offer it here. It may be appropriate for you, it may be not appropriate for you. It all depends on what your x-rays show. I hope this kind of helped cover a little broad overview of bunions for you, and if you guys have any questions, you know where to find us.